Mr. Dilip Patil, please. Yes, yes.
Good afternoon. I thank you. I thank organizers for inviting me, and this was a surprise. I was not aware of this lecture, so I prepared. And my colleague, Mr. Kiran McBride, has already very effectively told you about hospital-acquired infection and the solution which we have. So I will rather dwell on something which is rather practical questions you may have, like frequently asked questions. You please visit our booth at the back of this hall. We have actual demonstration of the equipment there. So infectious viruses, bacteria, fungi, they're all in the air, that's a big problem. Then we have been using many air filters. There are tens and hundreds of air filter company, air sterilizers or air purifiers in the form of ionizers, UV lights, fumigations, ozone, hydrogen peroxide, and all these things. But they're all having their inherent drawbacks. All these technologies have inherent drawbacks. They need a lot of maintenance. They're expensive to maintain. So hospital acquired, as Kiran McBride has told you, that it is the top 5 causes of death in the world. So hospital acquired infection causes more deaths than the road accident, breast cancer, AIDS, and armed conflicts put together. So it's a huge problem. In America, about 1 lakh people die every year due to healthcare-assisted infection, HAIs, which cost them additional $40 billion annually. And this figure is from CDC America. And then there's an issue now. Most bacteria are developing resistance to commonly used antibiotics, so which leads to higher doses and more expenses, obviously. So African countries, the problem could be more severe. We don't have authentic data about this, HAIs or nosocomials. Immune-compromised patients in isolation rooms, ICUs, burns units, asthma patients. So they're more vulnerable to airborne pathogens. And the solution, as my colleague Kiran McBride told you, is a Novirus's cold plasma air sterilization technology. Plasma has been used in medical field for sterilizing the devices like endoscopes and equipment, but then sterilizing the air using plasma without affecting the patients. That is the technology. It's the latest breakthrough, which is being tried and tested in various healthcare establishments all across the globe. So we are launching it in India. This is just the launch phase, actually. This compact, maintenance-free, means that is something which is very pertinent in Indian context, that this technology or this equipment doesn't need any sort of maintenance. Means I say it with full confidence, no maintenance, absolutely no consumables, nothing to be replaced. You just plug and play it. That is something, the beauty of this technology. And then obviously it effectively eradicates up to 99.99% of viruses, bacteria, fungi, molds. It also eliminates odors and VOCs. So this is how the technology works. There's a plasma, and the infected air is attracted or rather sucked into the machine. And this very, very high voltage, low current plasma acts on the DNA of the pathogen, and it disintegrates. It breaks it into a natural part of the air, in the molecules of the air. So there's no residues or ash or anything remains. So how is it different than currently available solutions? So we have HVAC systems, we have HEPA filters, we have ionizers, we are using UV lights, we are using ozone, hydrogen peroxide, fumigators, and all those. And then we do have our hand wash and sterility protocol. But then, as I said, there is a maintenance and inherent limitation, because most of this technology, ionizer, they combine many technologies together, and it is very expensive to maintain. And we have reached the point of diminishing return with no technology available in decades, or rather, Kiran was very aggressive, said in a century actually. So plasma, which is the fourth state of matter, when the gas is energized, it is converted into plasma. That is how, and it's a cold plasma. And this company, Novirus, uses a very patented technology called dielectric barrier discharge plasma technology. So it was designed in the UK and manufactured in Ireland, so it's an Irish company. It is being used by numerous healthcare facilities in Europe and America, and also in Asia now. NASA research laboratory in California, they have validated this effectiveness of this technology, and they have published a white paper on this. Various independent clinics and laboratories have conducted clinical trials and studies using Novirus technology, and the papers are available online, or some of you or any of you who are interested, I can email it to you. And all these products are CE mark, they are UL certified, and they are manufactured in ISO certified factories. So there is a question, how do you monitor the effectiveness of this technology? Means, how do we know this technology is working? Obviously, there is no visible indicator of reduction in viruses unless you do the bacteria culture. So reduced colony forming units is the good measure. However, the basic reduction in odor, sensible odor and measurement of levels of VOCs, that is volatile organic compounds, in the air, and particles in the air is another way to measure. And we have a little solution there. If you can, we have some micro USB VOC monitor, which I can demonstrate to it at the back of it. It actually monitors online monitoring of the air. And then we have developed a smart air quality cloud-based platform, which is coming with sensors and GSM. So it both way it communicates with the Novirus devices, and it allows you to monitor remotely, monitor and control also the air quality in different. So this is how it will show you the air quality trend in the real time. India, yes, we are just launching this in India. So we don't have many installations in India, but then Just Look Hospital was the first one. They installed 3 units of Novirus in IVF department, in vitro fertilization department, 6 weeks back. And what preliminary feedback which we got just yesterday, that they have seen 70% increase in the blastulation rate. Blastulation rate is number of blastocysts, blastoid cells in the blastocysts. That is rather the standard to measure the quality of blastocyst or embryo. What's the size and how much area? These are basic questions you may ask. So we have 2 models. NV200 is just like a shoebox size, and NV800 is like 20-inch LCD monitor. You can watch, have a look at it, and it covers the area. The small unit covers the area up to 200 square feet with 10 feet ceiling height. Obviously, it varies depending on the room dynamics actually. And NV800, which is more effective, it covers the area up to 500 square feet with 10 feet height. So it changes the air 300 cubic feet per hour. There's a airflow volume for NV800. How expensive? Well, it is little more expensive than the expensive mobile phone or 4K TV. So the price is about between the range of 1.5 to 2.5 lakhs with a minimum life of 3 years. And we offer 2 years manufacturer's replacement warranty. So you don't need any maintenance. At the same time, we offer you 2 years warranty. So that makes sense, more economical sense actually. The staff sickness, as Mr. Kiran also told, is reduced drastically, and it increases the productivity. The users of Novirus can proudly claim to be, I have seen it in Ireland and England, that people are putting the plaque on the hospital, that this facility is protected from Novirus airborne virus control technology, and that attracts a lot of patients and goodwill of the patients also around the healthcare facility. So can Novirus technology, can this be used at homes, offices, schools, hotels, common areas? Yes. Existing Novirus unit, small unit, can be used at any close place where there is a danger of airborne infection. But we are, because this this may not be cost effective for domestic users. So Novartis is launching early next year, or rather first quarter, a smaller and less expensive unit with the same technology, same effectiveness for homes and toilets early next year. So how big is the infection control market in the world? This is a report. A global infection control market is estimated to reach 16.7 billion by year 2020 at a CAGR of 6.7%. And India is guesstimated to be sharing more than 20% of this market share. So it's a huge thing for India. Well, let's have better air, better care. Thank you. Please do visit our booth at the back of this hall. Thank you.